Good morning. We will have a short discussion about the oro-antral fistula. Oro-antral communication. It's an unnatural communication between the oral cavity and the maxillary sinus. When the communication is left untreated, it will take 7 to 8 days for the epithelial tract to develop, which is called the oro-antral fistula. Depending upon the site, it is classified into alveolo-sinusal, communication between the alveolus and the sinus, palato-sinusal, communication between the palate and the sinus, vestibulo-sinusal, communication between the vestibule and the sinus. Coming into the etiology, the most common etiology associated with the development of communication is the extraction of upper first molar, followed by second molar and the third molar. The reason behind it is the thickness of the bone between the posterior maxilla and the maxillary sinus and the close proximity of the molar with the maxillary sinus. So this is a reason for the development of the communication following the extraction of posterior teeth. So this is a flow chart which shows the most important etiology associated with the development of communication, fistula, and the chronic oro-antral fistula. Communication, which includes extraction of posterior teeth, infection in the antrum, surgical removal of cyst, and the tumors in the posterior maxilla, trauma, and the periodontal infections. Oro-antral fistula includes infection in the antrum, dentoalveolar infections, Paget's disease, destruction of portion of sinus by cyst or a tumor, iatrogenic following failure in the primary ileum of communication. Coming to the chronic oro-antral fistula, improper treatment of communication, development of chronic maxillary sinusitis. Coming to the signs and the symptoms, most common signs and the symptoms associated with the fresh oro-antral communication includes 5 E's: escape of fluids from the nose, epistaxis, bleeding from the nose, escape of air from the nose, mouth into the nose, enhanced column of air, excruciating pain. Whereas in the late stage, the symptoms of fistula, which includes 5 P's: pain, purulent nasal discharge, post-nasal discharge, possible sequelae of general systemic condition includes fever, malaise, popping of antral polyp. Diagnosis, it includes a chairside investigation and the imaging. So the chairside investigations, which includes, just remember the name, extra and intraoral examination, patency of communication can be tested using the rinsing the mouth. When there is a patency, the oral cavity, the fluid inside the oral cavity will escape out through the nose. Valsalva test, cotton wisp test, mouth mirror test, general functioning test. Do not do the probing test because this will pave way for the entry of microorganisms from the oral cavity into the sinus. Imaging, which includes IOPA, OPG, PNS, occipital mental view, CBCT, and the paranasal CTs. So coming to the management of communication will be different from that of the fistula. In communication, the management will vary depending upon the size. If it is 2 mm or less in size, advise a patient to do the sinus precautions, which includes not to gargle vigorously or sneeze vigorously or to blow the nose. So advise certain antibiotics and the NSAIDs, which will helpful in healing of the sinus inflammations. Along with that, do not probe into the sinus. As I told, it will introduce foreign bodies. If the size is 2 to 6 mm, just do the figure of 8 suture to preserve the clot and within the socket. Followed by advise certain drugs and sinus precautions. If the size is 7 mm or larger in size, repair it as soon as possible in order to prevent the development of the fistula using a most commonly used flap is buccal advancement flap. So this is a picture, chart which shows the various flaps available for the management of fistula, which includes autogenous, allogenous, xenograft, synthetic metals, and the others. Autogenous includes soft tissue flap, which includes local and the distant. Local includes buccal, Rahman or Moxair, palatal flap, buccal fat pad, free mucosal graft, and subepithelial connective tissue graft. Distant includes tongue flap, auricular cartilage, and temporalis muscle flap. Fibrin includes LPR and the PRF. Bone graft, you can harvest from chin, retromolar region, zygoma, iliac crust, and the septal cartilages. Allogenous, fibrin glue and the dura. Xenograft, collagen, gelatin film, and the biogates can be used. Synthetic of the metals includes gold, aluminum, tantalum, polymethyl methacrylate, hydroxyapatite, root analog, titanium. Others includes intraseptal alveolotomy, GTR, Prolamin gel, splint, and the laser light. So there's a pictures which shows the flap. So it can come as a picture-based question for you people. So just remember the picture. First one shows a buccal advancement flap given by von Regemann in 1936, Berger in 1939. Second picture shows the buccal sliding flap. You just elevate the flap and slide it to close the fistula. This shows the palatal rotational flap. So this picture shows a palatal rotational flap, and this shows a combination flap, harvesting the flap from buccal as well as palatal region. So there's a picture that shows the distance flap. One of the distance flap is trunk, other two is auricular cartilage and the temporalis. So coming into the summary, just remember what is communication, types of communication, and the fistula. The duration is 7 to 10 days following communication. Fistula will develop. The most common etiology is extraction of upper first molar. And then the most common some signs and symptoms for communication is 5 E's, fistula has 5 P's, followed by the diagnosis using a chairside examination and the investigation. The management, it's depend upon the size for communication, and for fistula, there is a various flaps are available, and just remember the names of the flap and the pictures to rule out and to sort out these MCQs. So there's the most important points you have to remember to sort out the MCQs, which will come from the Oro-Antral Fistula. Thank you.